Hi students, welcome you all for the rapid revision on human health and diseases. I welcome you all for this session. This session, when it comes to human health and diseases, is again a very nice, interesting, more exam oriented chapter pertaining to the NEET exams. So we are going to do a quick rapid revision on the human health and disease. Yes, so this is going to be a very nice, interesting chapter also. Okay, so let me start the session. Yes students, I'm just starting the session. Okay, I welcome you all again for this nice rapid revision round on human health and diseases. This chapter, it's amazing, and at the same time more exam oriented questions do fall from this chapter. So we are going to have a nice interactive informative session on this rapid revision. Okay, so let me start the session. So I welcome all the students who have joined the session. Let me make the arrangements. Acha. Okay. Yeah, I'm starting. Yeah. Now we'll see the first question. Which is the correct sequence of events of inflammation or phagocytosis? Okay, so that is the first question that we are going to see. So what is the correct sequence? The correct sequence, okay, what is the correct sequence of the events of inflammation or phagocytosis? Vasodilatation, diapedesis, adhesion, chemotaxis, phagocytosis. The second option is vasodilatation, adhesion, diapedesis, chemotaxis, phagocytosis. Adhesion, vasodilatation, diapedesis, chemotaxis, phagocytosis. Vasodilatation, adhesion, chemotaxis, diapedesis, and then phagocytosis. So what should be your answer or the sequence of events? First, let me tell me what is inflammation. Okay, I generally say that inflammation is a reaction of your tissue to an injury. For example, you walk on a road, somebody comes and just slap you. How do you respond? Either you will scold them back or you give them a slap. Same way, when your tissue is injured, how is going to react back to you? It is by inflammation. So this inflammation has got a lot of cardinal signs in terms of swelling, redness, warmth, loss of function. That is a different area now. But here they are asking you to make up the correct sequence of events, okay, or in terms of phagocytosis. Suppose say a pathogen is entering in. Yes, definitely there is going to be an inflammatory reaction. And what are the steps? Okay, so let me tell you. So imagine this is your blood capillary wall. They are beautifully lined by the endothelial cells. Acha. Okay, and then we have all the WBC, RBC, okay, and the platelets, they are all moving here. Now imagine there is a pathogen here. Now what will be the steps here? It is there in the tissue, right? So what will be the first step? So first here is the vasodilatation. That is, there is going to be increase in the blood flow. Acha? Then only the permeability will be increased. The second step is called the diapedesis. The second step is called the the diapedicis, that is, they are going to put forth the pseudopod like limbs, and they are going to squeeze through the capillary wall, and they are going to move out of the capillary vessel, which is called the diapedicis. Okay, so before this diapedicis, what they do is these cells will come and stick on to the endothelial walls. Okay, that we call it as the adhesion. The second step would be adhesion. Yes. And then there will be what is called the diapedicis. After that, they move out of the capillary wall. Now these pathogens, they secrete some chemicals to attract the WBCs to the area of infection. These are called chemoattractants, and the process is called chemotaxis. The process is called chemotaxis. And what will be the last step? So imagine this is your, I am just enlarging your WBC. Okay, there are a lot of lysosomes. Lysozyme enzymes are also there packed with it. So you are having the bacteria here, opsonization. Now what happens? The next step, there will be engulfing of this inside, and there will be fighting within these things, and what will happen? The debris alone will be released out through the process of exocytosis. So this engulfment and neutralizing with the powerful hydrolytic enzymes by the process of phagocytosis. This is the fifth step. So what should be your answer, children? Yes, Shreya, Jivita. Yes, the answer is, first step is vasodilatation, the second step is adhesion, the third step is diapedicis. Diapedicis itself they can ask you as a question. The WBCs, the neutrophils, okay, the neutrophils, okay, they squeeze through, or the best word what we use in the medical books, we say insunate. So they just insunate, or they squeeze through the capillary endothelial cells and pass out into the tissues by a process called diapedicis, and then these pathogens, they release some chemicals particularly, and they will be attracted to this area of infection, what we call it as chemotaxis, and then we have the next step of phagocytosis. Okay, children, so that, but what you people have said is yes, vasodilatation, adhesion, chemostasis will not be there. This should follow, then only the chemotaxis should come. Okay, ma? You are all able to follow? Yes. We'll go to the next slide. Correct about entamoeba histolytica or amoebiasis is parasite of small intestine, causes dysentery, houseflies are mechanical carriers. Symptoms include constipation, abdominal pain and cramps. So they have given a list of statements and they want you to find out the correct statements. What are the correct statements? I hope you would have heard about amoebiasis, which we say traveler's diarrhea or dysentery. Like what happens there, it is mainly caused by the entamoeba histolytica. Yes. So what happens, this parasite, okay, through the contaminated food, water, by the fecal-oral route, they just enter and they bring about this disease. So what should be your option, ma? Answer, yes, Shreya, Anandita, excellent, Jivita, good. All are correct answer, because see, entamoeba histolytica is a parasite of small intestine. It causes the dysentery, and at the same time the houseflies are the mechanical carriers, and these are the symptoms that is often complained by the patient with amoebiasis. They will be the silent carrier in the house and they will just keep on spreading also. So the entire thing is correct. Excellent. Everybody have given the right answer. Excellent, ma'am. Yes, here comes a very nice, interesting, I just love this match the following, but let us see how you are going to make it up. Okay, so see here we have column A with list of all the tests, the pathogens and various symptoms, all that they've given, and here you have to correlate with column B. Okay, fine. Let us start doing this. Yes. Okay, allergy, T helper cells, hallucinogens, liver, Vidal test, filariasis, ELISA test, AIDS virus, treatment of cancer, X-rays. So here they have given a list of typhoid fever, single-stranded RNA, Wucheria, IgE, cirrhosis, atropha belladonna, activation of B cells, carcinogens, AIDS, immunotherapy. So what should be your answer, ma? Let us start deriving it. Okay, fine. So now let's see, first is allergy. When it always comes to allergy, I will say the first person who comes in your rescue will be your IgE. Okay. And what about the T helper cells? Always the T helper cells are so good, so kind enough. They are always going to activate your what? Activation of the B lymphocyte. They are going to activate the B lymphocyte. Okay. Then we have the hallucinogens. So what are the hallucinogens that we have to know? It is the atropa belladonna, right? Yes. What about the liver? The liver is always with the cirrhosis. Acha. The liver is always with the cirrhosis. The liver is always with the cirrhosis. Okay. And then, okay, wait. The liver is always with that of the cirrhosis. And then, 1 minute, I'll just change the color. Okay. Then we have Vidal test for the typhoid. Acha. Filariasis with Wucheria. What about the ELISA test? AIDS. What about AIDS virus? They are single stranded RNA. Right. What we are working out is right. Treatment of cancer, we can go for immunotherapy. Like in terms of alpha interferon and all that. X-rays, they are the carcinogens. Okay. So which should be your option? Let me check. Children, yes. The answer is exactly what you have given is the right answer. Excellent mark. So this is how you are going to correlate and make up your answers. Murugan, Tirisha, Akshaya, Jeevita, Anandita, excellent. You all have given the right answer. Shreya also. So this is how you are going to make it up. Okay, good. See, how are we going to sorting out? See, when I say allergy, what is there? It's the antibody. Whenever there is an allergen which is entering the body, okay, immediately the IgE is the antibody that comes. These both will go and trigger the basophils and mast cells to release the substance that induce allergy. So this should be there. T helper cell, we are very much aware. They not only help in proliferation of T cells, but they are needed for the activation of B cells. That is why in AIDS, when the helper T cells are affected, there is entire paralysis of the immune system. The hallucinogens, we know atropa belladonna. What about liver? In alcohol, when there are going to be a chronic alcoholism or following some infections like hepatitis and all, cirrhosis is the end of it. It is the end stage liver disease. What about the Vidal test? The typhoid fever. Filariasis, we are very much aware of that parasite, the Wucheria. It is an helminthes, right? Wucheria bancrofti. What about the ELISA test? Very common that they do for the AIDS. What about AIDS virus? It's a HIV virus which is a single stranded RNA. The treatment of cancer, apart from all the other therapy, immunotherapy is upgrowing one in the field of oncology. And what about the X-rays? Yes, it is one of the potent carcinogen. So like that you have to make and match the derive with the answers. Okay. Yeah. Which of the following is a pair of viral diseases? Viral diseases ma. Okay. Ringworm AIDS, common cold AIDS, dysentery common cold, typhoid tuberculosis. Okay, we will come from like, what about typhoid and tuberculosis? Typhoid is caused by what? Salmonella typhi. Okay, what about the tuberculosis? The Mycobacterium. Yes, it is caused by the Mycobacterium bacilli. The dysentery by many bacilli are there. What about common cold? The rhinovirus. So this cannot be the option. This is one bacterial, one viral. This cannot be. They are asking a pair of viral diseases. What about here? What about here? Common cold and AIDS. This is by the group of those virus belonging to the rhinovirus category. What about AIDS? The HIV virus. So this should be the right option. What about here? Ringworm is fungal. AIDS is a viral. So this cannot be the option. So this is how you are going to choose it. Yes, excellent. Vasant, Tirisha, Jeevita, Shreya, Anandita. Yes, you are all giving the right answer. Excellent, ma. ELISA test is used to detect hepatitis B, syphilis, gonorrhea, all of the above. What should be your answer? I hope you know what is ELISA, right? It's an enzyme linked immunosorbent assay. It's a test. Usually this test is done where you are going to find out the antibodies. Okay, it's a test that detects the antibodies against that particular pathogens for hepatitis B, syphilis, and then we have for the gonorrhea. So what is the test? that it can do. You know that it's for AIDS because we saw in one of the match. Whether it is used for all these, yes, what should be your answer? Yes, somebody has given the answer all of the above. No, it is actually, see, it was first described by Engvall and Perlman in 1971. Actually, the ELISA, there are many types of ELISA. There are there, like direct ELISA method is there, or it can be an indirect or a sandwich type or a competitive ELISA. So here in the ELISA, it stands for enzyme linked immunosorbent assay test. So commonly they will be detecting the antibodies in the blood. Okay. So here we will use it for the hepatitis B mostly. Okay. So when it comes for syphilis, okay, we will be using what is called the rapid plasma regimen test. Reagent test. What about for gonorrhea? We use what is called NAT. Actually, we take the swab from the vagina and from the men also, and then we will check for this nucleic acid amplification testing. So these are the common tests that is done for gonorrhea and syphilis. But for the ELISA, we will be doing the hepatitis B. Okay. Okay. Most radiosensitive tissue of body is bone marrow, platelet, nervous tissue, lymphocyte. What should be your answer? What should be your answer? Yes, I am looking for your options, what you have given. Yes. Yes, children, what should be the option for this? No, ma, it cannot be the other one which you said all of the above, because I have given the explanation. So the hepatitis B, the antibodies that they use to find against that particular antigen, the ELISA test is used. Whereas for these two, we use these two tests actually. Okay. Okay. Okay, coming here, most radiosensitive tissue of the body is bone marrow, platelet, nervous tissue and lymphocyte. What should be your answer? What should be your answer? Yes. Now we will see the radiosensitive tissues. What do you mean by that? They are actually the tissues where they will be more undifferentiated. They will have well nourished, where they have the capability to divide very nicely there. Okay, they will have a high metabolic thing there. That is why we call them as the most radiosensitive. Excellent, Tirisha, Jivita. Yes, it is the bone marrow, because the bone marrow has got that capability. It has got highly undifferentiated cells, it will be highly metabolic, and it will also be very well nourished and all. So that is the most sensitive tissue of the body. But many children, they will immediately choose the lymphocyte. If the question is asked most radiosensitive cells of the body, then you can choose lymphocyte. If they ask most radiosensitive organs of the body, then you can, system is GI system. Okay, if they ask organs, you can go for ovaries and testes. So like that you have to choose like which they are asking for. Okay, good, good Anandita, Akshaya, Shreya and everybody. Good, good, good. Next, here comes a question. LSD is hallucinogenic, sedative, stimulant and tranquilizer. So what do you mean by hallucinogenic, or what do you mean by sedative or stimulant? I hope you know the answer. Sedative, like you give it to person who don't have the capability to sleep, like they do suffer from insomnia, like that. Stimulant, like usually when their entire system is down, their central nervous system, like you give a stimulant to trigger that up. Tranquilizers, like we wanted to put them to rest, relax, there we use tranquilizers. Hallucinogenic, like where they will be in their own world. It can be of any form, like they will like we have what is called illusion, which is common in you and me, like looking into a rope you will say a snake, it is illusion. Okay, but what you have to know here is when it comes to hallucinogen, like it's something false delusions or hallucinations, like we can say, like they will have their own world, they will have their own imaginative things where they go in for perceptions rather, we can say. So LSD is a hallucinogenic. Yes, you are all right. So we say it is actually banned in all the countries, like lysergic acid diethylamide, where commonly we call that as acid. It's a hallucinogenic drug. Mostly what happens, these drugs, when it is mixed and given and all, no, so these people, they'll have altered thoughts, feelings, and the awareness also. So they will hear, like what I said, no, like they'll have visual or auditory, like they feel like somebody calling them or something like that, or they'll see something which is not existing at all. So that is very common with the usage of lysergic acid diethylamide, which is a hallucinogenic substance. Yes, excellent, Jeevita. Good ma, you're giving the answer, everybody. Yes. Now here comes another interesting question. A person showing unpredictable moods, outburst of emotion, quarrelsome behavior and conflicts with others is suffering from mood disorders, addictive disorders, schizophrenia, borderline personality disorder. What should be your answer? Mood disorders, addictive disorders, schizophrenia, borderline personality disorder. What should be your answer? Yes? Yes, students, I want you to post the answer. Yes? What should be the answer now? What are mood disorders? Like mood disorders, it can be like bipolar, mania. Those are all classified under mood disorder. So this cannot be there with it. Addictive disorders, like in terms of drugs or alcoholism, where you don't find this. What about schizophrenia? It's an entire different scenario. It's a form of psychosis where the people, where they will have that multiple personality disorder, where that cannot be there. So it is the borderline personality disorder, where they'll have that unpredictable moods and they'll outburst themselves in the form of quarrel, conflicts with other. So in personality disorder, it's a separate. We have actually DSM classification. Okay, according to our DSM, okay, there is one classification with the personality disorder, and borderline personality disorder is one such. Okay, which one of the following is a correct statement regarding the particular psychotropic drug specified? Opium stimulates nervous system and causes hallucinations. Morphine leads to delusions and disturbed emotions. Barbiturates cause relaxation and temporary euphoria. Hashish causes altered thought, perceptions and hallucinations. So now first, always correct statement you are going to pick up regarding what? The psychotropic drug. Okay, now we are going to choose. So what should be your answer, children? Okay, so first we will start from opium. Opium stimulates. No, opium will not stimulate. It's a depressant. It will not cause hallucination and all. Okay, it will reduce the anxiety, tension. So that cannot be your answer. Morphine. Morphine is not with delusion or disturbed emotion, because morphine we will use actually as a good analgesic, actually morphine. Okay, where very strong analgesic, and it will push the person into a state of losing the conscious, and it's a very good what do you call, analgesic. Psychotropic drugs means actually those drugs which will alter the mood. Mood altering drugs are called psychotropic drugs, where it will act on your brain and it will alter your behavior, your consciousness and your power of perception. When I say power of perception, that's something to do with hallucination. Okay. What about barbiturates? Barbiturates, when you see, actually even they don't cause relaxation and all, or temporary euphoria. Okay. So what should be your answer? The hashish. Yes. Hashish is actually from the cannabis sativa. Okay. It's a hallucinogen actually. It is actually, the hashish is taken from that cannabis sativa. Okay. It is a hallucinogen, and that is the one which will alter the thought, perception and hallucination. So what should be your answer? Yes, the answer is hashish. That is the right statement they have given. See, opium is a depressant. Morphine is going to be an analgesic. Even barbiturates we use for analgesic. It's going to put you down calm. Okay, not bringing about euphoric state and all. But what about when you take it from cannabis sativa? Yeah, definitely it's a very good hallucinogenic. So that is why. So psychotropic drugs means what? The mood altering drugs. The mood altering drugs in terms of what all? In terms of behavior, consciousness and then power of perception. This is where we learn like that in pharmacology. So you classify them under this. So anything if they ask in the exam, you can very well pick it out. Okay. The chronic use of alcohol damages the liver. This is known as cirrhosis, hematosis, anaphylactic shock, Jacob syndrome. So when a person is put on to a chronic alcohol, it damages the liver. We are very well aware of it, right? So what it is going to bring about? What it is going to bring about? Yes, the answer is Yes, children, I am waiting for the answer. See, it cannot be hematosis or Jacob syndrome, which is totally out of this contrary question. Anaphylactic shock is something different. Okay, anaphylactic shock is actually a condition where there is going to be a disparity in the circulating volume as well as in the pumping of your heart, the blood, that volume that it contains. So there are many types of shock, and one shock is anaphylactic shock, like people having a scorpion sting, okay, or if they are going to be having say for example some drug reaction or anything, they can go with anaphylactic shock. But this will not be the answer. So excellent, Anandita, Tirisha, Jeevita, Shreya, Akshaya and all that. The answer is cirrhosis. Yes, very good. Excellent. Okay, so what will happen is there will be more areas of necrosis, okay, so that the tissue will become non-viable. They will not be viable enough, and so it lands up with cirrhosis. Okay, good. Which of the following group can be considered immune disorder? So which is something related with the immune dysfunction? AIDS, cholera, SID, diphtheria, SID and AIDS, hepatitis and leukemia. Hepatitis and leukemia. Yes, you please answer this. Yes, what should be the answer? Yes, children, I am waiting for it. See, look here, AIDS we know. Yes, it's a disease which is caused characteristically by the HIV. It is going to paralyze your entire immune system. It causes the paralysis of the immune system, probably because it affects the helper T cells. Yes, so that is the reason. Cholera is by the Vibrio, cholerae vibrio, right? It's a comma shaped bacteria which we know, bringing about rice watery stools, right? Yes, so that cannot be the option. SID and diphtheria, no, this is also a severe combined immunodeficiency, so this cannot be there. So yes, all are bombarding with the right answers. Yes, ma, it's SID and AIDS, both are immunocompromised conditions. Hepatitis is inflammation of the liver. Inflammation of liver. What about leukemia? Leukemia is nothing but increase in the WBC count, which is a cancerous condition, which we call it as blood cancer, right? So that is with it. So this cannot be the option. So what should be your answer? Yes, SID and AIDS. Excellent, children. Anandita, Sirisha, Vasant Kumar, Shreya, Akshaya, Jeevita, everybody good. Today very nicely you people are involving, very nice. So that is where, good. See, actually there is one more thing which I want to give an emphasize here. There is one more term called leukocytosis. I hope you children would know about it. This is also increase in the WBC count, okay, but here the count will go in millions. You know the normal WBC value, it is only 4,000 to 11,000 cells per cubic mm of blood, right? Okay, here it will be just more than that, not more than 50,000 like leukocytosis. But when it comes to leukemia, the count will go very, very high. Okay, that is why it is a cancerous condition. Okay, there are many types of leukemia also. Good. Which of the following is correctly matched? See, correctly matched. We are going to see correctly matched. Anopheles, malaria, housefly, yellow fever, body loose, typhoid, sandfly, plague. We will go from down. What about with sandfly? Sandfly is something responsible for causing the leishmaniasis. What about plague? It is by that Yersinia pestis, which is caused by the rats, right? This is the flea and it is passed by the rodents. So this cannot be the option. What about body loose? It's a sort of ectoparasite, right? It's a type of ectoparasite. Okay, so that will cause like itching and other things and all. What about typhoid? Salmonella typhi. So both are different. So both cannot again form the option. What about housefly and yellow fever? Housefly is with some other, like it causes dysentery, typhoid, like that. What about yellow fever? That acute viral hemorrhagic disease. Okay, that is caused by the Aedes mosquito. So that cannot be the option. So what should be the answer? Excellent. It is the female Anopheles mosquito, okay, which is going to be the vector for transmitting the Plasmodium vivax falciparum, okay, into the humans. Okay, malaria is the disease. It's a protozoan disease. Yes, excellent student. You are given the answer. Protozoan disease. Very good. Which is not cancer? Leukemia, trachoma, carcinoma, sarcoma. Which is not cancer? Which is not cancer? Yes. I am waiting for your answers. Yes, children. Yes, excellent. Many people have started giving me the answers. Excellent. So, which is not cancer? You see, leukemia, I already said something to do with blood cancer. Carcinoma is cancer. Sarcoma is to do with the connective tissue. But what about trachoma? Yes, trachoma is actually an infectious disease which is caused by the bacterium Chlamydia trachomatis. This infection will cause that inner surface of the eyelids to become more rough. There will be more pain, swelling, inflammation of the cornea. See, this part what you are seeing is the cornea. This part is the sclera. So, there will be more infection of the cornea and blindness also. So, this is what with trachoma, trachomatitis we say. Okay. Yes, trachoma. Excellent. Anandita, everybody have given the right answer. Sweta, Jivita, Tirisha, Shreya and all that. Good. Good to see that. Yes, nice. It's an interesting question. Turner syndrome is caused by polyploidy, autosomal aneuploidy, sex chromosome aneuploidy, trisomy. So, what to do with Turner syndrome? What should be your answer? What is to do with Turner syndrome? What do you mean by Turner syndrome? Turner syndrome is actually, it's a single X chromosome. Yes, you have 45 chromosomes. Okay, and then one of the chromosome will be missing up there. So here sex aneuploidy is group of conditions in which the individuals, like you see the Turner syndrome, it's a condition that it only affects the females where one of the X chromosome will be missing there. Okay, XO type it is. So mostly they will have short height, they will have failure of ovaries to develop with heart defect and all that. And these people know actually the individuals, they will have this abnormal number of sex chromosomes like Klinefelter's or whatever, they all will be grouped under the sex chromosome aneuploidy. So that is where it is important. So it is called the sex chromosome. It's not with autosome, it is with the sex chromosome, because see, one of the X chromosome is missing or partially missing. That is why we say this as sex chromosomal aneuploidy. Yes, Anandita, you are right. Akshaya, you are able to follow now, Shreya and all? Okay. Which one of the following conditions in humans is correctly matched with its chromosomal abnormality? So here we are going to match. What we are going to match? The chromosomal abnormality and their linkages. Color blindness Y-linked, erythroblastosis fetalis X-linked, Down syndrome 44 autosomes plus XO, Klinefelter syndrome 44 autosomes plus XXY. Now here which will be the right option? Please children, give me the option. Okay, let me explain. When it comes to color blindness, it is actually not Y-linked disorder, it's a X-linked recessive disorder. Okay, color blindness. So that is wrong. What about erythroblastosis fetalis? This story is different. Rh negative mother, Rh positive father, they are going to have Rh positive child. Okay, now what happens during the first pregnancy, some amount of the blood might scoot into the Rh positive mother. She will develop antibodies against this Rh positive blood. If the second pregnancy also is going to be Rh positive, then this Rh antibodies, they will enter and destroy all the RBCs of the fetal, bringing about erythroblastosis fetalis. It is also called as Kern-Icterus. Why we call it as Kern-Icterus? Because the baby will have jaundice. Icterus means jaundice. Anemia. These are characteristic sign of erythroblastosis fetalis. Okay. So it is not linked with any genetic here. So that will not come into the picture. What about Down syndrome? Down syndrome is trisomy 21 we say, where in 21st chromosome in the autosome, it is not associated with the sex chromosome. First it is associated in the autosome. In the 21st pair, there will be 3 copies of that chromosome. So that is with the Down syndrome. So this is also wrong. So what should be here? It is a Klinefelter syndrome, which is 44 autosomes plus XXY. So what should be your answer? It is the autosome. So we say 47 plus XXY. So there will be additional Y chromosome present. Okay. Very good children. You all have given the right answer. Popular treatment method DOTS is adopted for the cure of dementia, tetanus, tuberculosis, sexually transmitted disease. For what we give this? Yes. For what do we give the popular treatment DOTS? Yes, for what we give, ma? Yes, children. Shall we move? When it comes to dementia, it is what? Dementia is actually memory loss, and this DOTS therapy will not applicable. What about tetanus, which is also commonly called the lockjaw, which is caused by the Clostridium tetani, bacterial infection. So this treatment is not to that. Sexually transmitted disease also not. So what should be your answer? Yes, you are all right. It is called directly observed treatment short course. Directly observed treatment short course is a name we give for 6 months actually for the as a course, okay, to the tuberculosis, which is recommended by the World Health Organization. So what are the drugs that we usually give? We give rifampicin, okay, we give ethambutol. It's a combination, isoniazid and pyranizide. So these 4 drugs constitute the DOTS therapy, and that is how we administer it to the patients. Yes, you are all right, ma. Excellent. The disease tetanus, also known as gangrene, shingles, lockjaw, whooping cough. What should be your answer? The disease tetanus, which is caused by Clostridium tetani, which is a bacteria, it's also known as what? Mostly this disease actually it comes like people when they have say a wound, it mostly spreads through the wound. So for following the bites, wounds, like say when there is a prick on the skin and it's exposed, and even it's quite common following the delivery. The village side and all, they don't take much precaution. So what they used to do when they are exposed to such a thing, newborn baby might get tetanus, even the mother also, because that proper precautions they don't take. So it spreads through the cut wounds, cut infections and all that. Okay, so that is where this tetanus, that is why we go and put TT injection, no, that vaccine to prevent us from the tetanus. So what? Yes, excellent students, it's called lockjaw. See the person, the thing, what this condition, we call this as opisthotonus, we say in our medical terminology. The head here, the toe here. See, that much increase in the rigidity of the muscles, we say. The person will not be able to open up his mouth, that is why that lockjaw. So increase rigidity of the muscle because it affects all the nerves. So that is the reason. Okay. Sickle cell anemia is due to change of amino acid in alpha chain of hemoglobin, change of amino acid in beta chain of hemoglobin, change of amino acid in both alpha and beta chain of hemoglobin, change of amino acid either alpha or beta chain of hemoglobin. So what is sickle cell anemia? So usually we know that RBCs, they are biconcave shape, okay, but because of one hereditary condition, the RBCs become sickle shape. The RBCs become sickle shape. Sickle means it will be like this. So whenever they are exposed to low oxygen tension, they develop this sickling of RBCs. So when they pass through the tiny capillaries, they get ruptured and results in characteristic sickle cell anemia. So what is the real pathology behind it? It is because of the beta chain, that is in the 6th position. Okay, glutamic acid is replaced by valine. So that is the reason which brings about the sickling. Okay children, I hope you have given the right answer. Yes, excellent. So let me show the picture I have written there, and I have 1 minute. Yeah, see here. So you can see the normal, biconcave shape is because of 2 proteins. One is called spectrin, another protein is called ankyrin. If these 2 proteins are absent also, it will bring about congenital, hereditary spherocytosis. The RBCs will become spherical shape. But if in sickle cell anemia, the problem lies in the beta chain of the hemoglobin, where the RBCs is sickling. So that is characteristic here. Yes children, you have given the right answer. Excellent. Blood cells involved in inflammatory reactions are basophils, neutrophils, eosinophils, monocytes. What should be your answer? Yes, what should be your answer, ma? I already said inflammatory reaction. So in inflammatory reaction, what should be the blood cell involved here? Yes? Yes, it is none. Okay, let me come to neutrophil. The neutrophil, it forms the first line of defense mechanism. Yes, that is something to do with phagocytosis. What about monocytes? The monocytes form the second line of defense mechanism by the formation of macrophages, right? What about eosinophils? They have got anti-allergic and anti-parasitic effect. So what should be your option? Yes, it is the basophil. So the basophils along with mast cell. Children, please do understand. Basophils, mast cells, they release histamine, heparin, okay, and they bring about the reaction of allergy. Neutrophils are phagocytic cells, which I already said. What about eosinophil? They mediate the allergic response. What about monocyte? As macrophage, they are going to mount an immune response. So what should be your answer? Your answer is basophils, not neutrophils, ma children. Again I am telling you, the blood cells that is involved in the inflammatory, that is when it comes to inflammatory reactions, okay. So it can be like inflammatory reactions or hypersensitivity reactions. Hypersensitivity reactions. So when it comes to hypersensitivity reactions, okay, so it should be, when it comes to the hypersensitivity reactions, then we can make basophils, okay. So if they have added that word hypersensitivity, then we can say basophil. Yes, it's neutrophil. The inflammatory, yes, I agree with it, it is the neutrophil, yes. So the blood cells that is involved in the inflammatory reaction, as we saw first, they form the first line of the defense, it is the neutrophil. Yes, you're all right. An insect bite may result in inflammation of that spot. This is triggered by the alarm chemicals such as histamine and dopamine, histamine and kinins, interferons and opsonin, interferons and histones. What should be your answer? Yes. So there is an insect bite. So in that bite you are getting that spot, red spot. So what is that chemical that is bringing about that reaction? It is none other than histamine and kinins. Children, see, one thing I'll tell you. Say for example, even the previous slide which I talked about with hypersensitivity, let me give you one clear idea about it. See, when I say hypersensitivity reaction, okay, first there is something, an antigen, let it be an insect bite or anything. Whenever it goes, it binds with an antibody, that is the IgG, that is something to pertain with the allergy. Now what will happen? These two will trigger, okay, they will go break the basophils and mast cells. They are the cells responsible for that hypersensitivity reaction, and they are going to release chemicals like histamine, heparin, slow reacting substances of anaphylaxis like that, and bring about that allergic reactions. What are allergic reactions, ma? Like kinins and all. Allergic reactions means bradykinin and all. That is what kinins. Allergic reactions means like it can be from say those rashes, okay, or itching, to even sometimes bronchoconstriction also. Now immediately your eosinophils know it has got the anti-allergic activity. Okay, it has got the anti-allergic activity. Now what it will try to do? It will have the anti-chemicals of it, like histaminase. All this will have, which will have the eosinophil have. It will try to come and combat the allergic reactions. So this is the story behind the allergic thing. Children, you are able to follow? Yes. So this is the thing that you need to understand. The first line of defense of body is skin and mucous membrane, lymphocytes and monocytes, fever, interferon. What should be your answer? Yes, what should be your answer, ma? Akshaya, Shreya, Tirisha. Yes. What is your first line of defense? What is your first line of defense? See, when we say immunity, it is the ability of your body to protect against the various pathogens, cancer cells, transplant cells, that is the grafted cells. Your immune can be either innate immunity or it can be acquired immunity. Innate immunity is present right from the birth. Okay, so you have many such barriers in the body that is going to be present right from the birth, and it's going to protect against various pathogens. Acquired, it's as a developmental sequence. As you get exposure to a pathogen, your body is going to develop it. Like how you have the cell mediated immunity and the humoral immunity conferred by B lymphocyte and T lymphocyte. So here, which is the first line of defense here? Yes, it is the skin and the mucous membrane, not lymphocytes, ma. If I would have given neutrophils, then you could have chosen. It is not lymphocytes. So skin and the skin. Fever is a symptom. Interferon is a cytokine. Okay. But what is the main thing? It is the skin and the mucous membrane. They are the barrier. That is, yes, Nikit Kumar, you are right. So that should be your answer. Which of the following statement is not correct regarding malarial infection? You are going to see which is not correct. Regarding what? Malarial infection. The parasite reproduces sexually in the liver cells of human. The second option, high fever recurring every 3 to 4 days. Sporozoids initially multiply within the liver cells and then attack the RBCs, resulting in their rupture. When a female Anopheles mosquitoes bites an infected person, these parasites enter the mosquito body and undergo further development. Okay, so let us see what are all the statement that is not correct. See, when a female Anopheles mosquito bites an infected person, these parasites will enter the mosquito's body, okay, and it will have further development where that gamete development will start. Yes, right. What about here? Sporozoids initially multiply in the liver and then it will attack the RBC. That is how sporozoids, monozoids, okay, they will start dividing. Okay, then only that hemozoin, that chemical will be released, bringing about chills and all that, resulting in the rupture. Yes, that is also correct. High fever recurring every 3 to 4 days. This is also right. So what should be the option? Yes, the parasite not sexually, it is asexually, it reproduces in the liver cell. So what should be the right answer? It is the parasite reproduces sexually in the liver cells of human. Yes, very good. Anandita, Jeevita, Nikit, Shreya, Sirisha, everybody giving right answer. Good. Out of the following diseases, which are caused due to bacterial infection? Typhoid, elephantiasis, cholera, tuberculosis. So here of this disease, which is caused by bacterial infection. So we should know that typhoid is caused by what? It is caused by the Salmonella typhi. Okay, it is a bacteria. It's a bacteria, right? Okay. What about the cholera? Vibrio cholerae. Okay, this is also a bacteria. TB, Mycobacterium tuberculosis. What about elephantiasis? It's caused by an helminth, right? What is it called? Wucheria bancrofti. Yes. So what should be your answer? The elephantiasis is what? It is nothing but the filariasis. So what is the answer? Yes, students, you have given the right answer. A, C, D. They are the right one. Elephantiasis is caused by the helminth, Wucheria bancrofti, by that Culex mosquitoes, which blocks the lymphatic channels. The nematode will go blocks the lymphatic channels and brings about that elephantiasis. Okay. The pathogens of genera Microsporum, Trichophyton and Epidermophyton are responsible for botulism, conjunctivitis, ringworm, skin allergy. What should be your answer? Yes, what should be your answer? Yes, let me discuss about it. Okay, so now coming on for these infections, okay, that's caused by Microsporum, Trichophyton. Okay, so first when it comes to botulism, we say food poisoning, no, that botulism toxin. So Clostridium botulinum is the bacterial disease, okay, that food poisoning. So this cannot be the option. What about conjunctivitis? Conjunctivitis is inflammation of the conjunctiva. It can be because of bacteria or it can be allergic. Even dandruff can bring about that conjunctivitis, even bacterial, viral and all that. Skin allergy, any allergens, any allergen, it can be anything. Okay, so all this cannot be. So it is a ringworm infestation, a fungal infestation because of Microsporum, Trichophyton, Epidermophyton. They all are responsible for that ringworm. Yes, you are all right, children. Which of the following immunoglobulin is present in colostrum? IgA, IgG, IgM and IgE. So what should be your option? Yes, I am waiting for your answers. Yes, excellent. Yes, students, you are giving the right answer. Yes, I am looking in the chat. Yes, the answer is IgA. See, IgA is also called as secretory immunoglobulin. Okay, it is called the secretory immunoglobulin. So colostrum is a liquid substance that is being excreted in the mother, right? See, following the delivery, okay, the first few days the mother will expel what is that called from the mammary glands called the colostrum. Okay, so that is very important following the delivery because it can kill millions of pathogens. That is why breastfeeding is so important. Okay, that is why we emphasize the breastfeeding to the telling to the mothers to feed their children. So IgA, not only it is there in the colostrum, it is also present in the tears, saliva, any fluids. Actually we have this protection. What about IgG? It is a secondary immunoglobulin, okay, and like it is going to be a secondary antibody that has been produced during that response, okay, and then it's a only antibody that can cross the placenta and it can also confer the immunity to the fetus. Okay. Second, coming to IgE, it is the one which is responsible in that allergic reaction, hypersensitivity reaction and all that. IgM is the antibody that will be produced during the primary immune response. See, for example, when a pathogen is entering us, the first the antibody should be produced, that will be your IgM. Okay, so now it would have recognized your pathogen and the thing would subside. Once when the second time the same thing attacks, okay, there will be a mounted response, we say, that will be done by your IgG. Okay, so these are regarding, so you are all right, the answer is IgA. Okay, Nikit Kumar, RH incompatibility, exactly Nikit Kumar, he is now giving, excellent, this is what I wanted you all to participate, children, excellent. I want to give a very good hand of applause to you, very good. See, RH incompatibility is here, that is why, excellent, I can put you one more what I know I can discuss here. See, already I said no, those antibodies which the mother is forming, it will be of IgG type. That is why it can cross the placenta. It's not that all the antibodies are harmful. I'm talking about the Rh negative mothers, and that is why it is bringing about the scenario of the erythroblastosis fetalis. Okay, that is why it is bringing about the scenario of erythroblastosis fetalis. Then the next thing that you need to know here, another thing is, this is with the Rh system. Why not people developing these sort of incompatibility in the ABO system? Because they are of IgM type. They will not cross the placenta. That is the reason. Okay, IgM type. See, mother will be one and the baby will be one. But still, ABO system you don't have that incompatibility because they are of IgM type. Only with the Rh type we will have the issues. Okay. Yes, you are all right. Yes, excellent. Which of the following is an autoimmune disease? Asthma, cirrhosis, AIDS and rheumatoid arthritis. First, you should know about autoimmune disorders. Like when you take an immune system, it's like a seesaw. Okay. So, immune system has got the very good capability to recognize the pathogen. Like pathogen in the term of say bacteria, virus, fungi, etc. etc. Apart from that, cancer cells, tumor cells, that is tumor cells, and then also the grafted cells, viral infected cells, like that. Now, when I say autoimmune disorders, there are two planes, like you should know. Like one where your immune system totally gets paralyzed, like where you get infected with like AIDS and other thing. On the other end of the seesaw is the exaggerated response. Like they take up the charge, like in terms of allergy. What is that? Exaggerated immune response is allergy. Same way your autoimmune disorders, here they think they know everything. The body own antibodies, okay, it's our own antibody. They are destroying our own body tissues. And that is why we call that as autoimmune disease. There are classical examples of autoimmune disease. One such is rheumatoid arthritis. So antibodies are formed against the synovial, the membrane, and so that is why it is bringing about this destruction of the cartilage and the bone, and people, it's like a crippling disease actually. It brings about arthritis is inflammation of the joint, so it will affect all. First they will have it will affect the small joints, and then it will spread on to the larger joints also. Cirrhosis is with the liver. I already told you, with chronic alcoholism the people do land up with this, right? And what about AIDS? We know with this, with the HIV and asthma, it's something to pertain with an allergic. It's not an autoimmune disease. Okay. So your answer is right. That is a rheumatoid arthritis. Apart from that, any autoimmune disorders, when we think about is like goiter, like thyroid issues and all, they are also most thyroiditis with autoimmune disease, SLE, systemic lupus erythematosus, myasthenia gravis. They are all classical autoimmune disease. Myasthenia gravis. What is myasthenia gravis? The antibodies are formed against nicotinic receptors. Okay, they are formed. Yes, psoriasis, good. Nicotinic receptors against in the neuromuscular junction. Okay, in that. So that you have to know. Okay, myasthenia gravis. You know which famous personality do suffer from myasthenia gravis? Amitabh Bachchan. He has myasthenia gravis. Which one of the following technique is safest for the detection of cancers? Magnetic resonance imaging, MRI, radiography, X-rays, computer tomography, CT, histopathological studies. Yeah, even Cushing syndrome. Yeah, it's an autoimmune. Yes, very good, Nikki. You can give lot of examples actually. We have so much with autoimmune diseases. Yes, what should be the answer here? Even Addison's disease, all that. Magnetic resonance imaging, radiography, computer tomography, histopathological studies. What should be your answer? What should be your answer? Yes, excellent student, you are giving the answer. See, always I say, even to my patients, that MRI is the safest, because MRI, it uses only the strong magnetic fields of 1.5 Tesla and all, and non-ionizing radiation, where you can very well find out what is the physiological structures and as well as the pathological changes in the living tissues. So MRI. But when it comes to others, all they will harm your body, like X-rays or CT. CT is what? It's a three-dimensional X-ray. And histopathological studies, where it will involve putting a needle, taking out and harming the body. So the best way I always say is use of MRI. Okay, good. Yes, tick mark the correct match with respect to drug source and its action. SMAC, latex of poppy plant, Paparum somniferum. Depressant slows down body functions. Cocaine, Erythrooxylum coca. sense of euphoria and increased energy. Coke, atropha belladonna, hallucination. Hashish, cannabis sativa, hallucinations affect cardiovascular system. So this hashish is a colloquial name. Cannabis sativa, hallucination, affects the cardiovascular system. What about smack? It is from the latex of poppy plant paparum. It's a depressant, which I already told. Cocaine, erythrooxylum coca, sense of euphoria. Euphoria is an ecstasy state with increased energy they'll have. So the answer is what? It is coke. Coke is also from the erythrooxylum coca. Same way, they will have that increased sense of energy with hallucination. Okay, so that should be the answer. Yes, very good. All have given the answers. Excellent. Very good. Yes. Now here coming on with which one of the following options gives correct matching of the disease, the organism and mode of infection. Elephantiasis, Wucheria bancrofti with infected water and food. Malaria, Plasmodium vivax, bite of male Anopheles mosquito. Typhoid, Salmonella typhi with inspired air. Pneumonia, Streptococcus pneumoniae, droplet infection. Let us sort out it. So first elephantiasis, yes, it's Wucheria bancrofti. It is not with infected water or food. It is by the mosquito bite, which I told already with the Culex mosquito, right? So this should be not the answer. Malaria, yes, Plasmodium vivax. It's not the bite of male. It is a bite of female Anopheles mosquito. So this is also wrong. What about typhoid? Salmonella typhi, not with inspired air, right? It is by the fecal-oral contamination. So that cannot be the answer. What about pneumonia? Streptococcus pneumoniae, droplet infection. So which is the option? Yes, you are all right. The last one is the right answer. Excellent, students. Yes, coming to the last question. Match the disease in column 1 with the pathogen, prevention or treatment that is given in column 2. Amoebiasis, diphtheria, cholera, syphilis. They have given treponema pallidum. Use only sterilized food and water. DPT vaccine. Use oral rehydration therapy. When it comes to amoebiasis, we ask the patient to eat sterilized food and water. What about diphtheria? The DPT vaccine. Cholera, oral rehydration, because I said they'll have that rice watery stools where that Vibrio cholerae actually it will be like one screw cork, like it will go affect the chloride channels of the large intestine, particularly of the colon, and they bring about release of so much of water along with minerals. So the patient will have such rice watery stools they will pass on. So the best ideal we give them the oral rehydration therapy. And syphilis is with the treponema pallidum. Yes, the answer is right. Yes, you people have given the exact answer. Excellent, very good. So I hope this session would have been more informative. Like it was very nice. We had a very good interaction today, especially many students, even Harish, Nikit, and many people like Tirisha, Shreya, Anandita, Akshaya, Jivita and all. So I see many people, they have come up and joined and they are giving up the answers. It's very nice to see you all. It was very nice, interactive, informative session. So I thank and wind up here, students. Meet you soon in the next rapid revision session on other chapters with the next 30 questions with swift and rapid round. Okay, meet you all soon. Thank you so much. Bye. Good night.